We're on location at the Cantech Investment Conference and we're joined by Lisa Crossley from Reliq Health Technologies. Lisa, thank you so much for joining us today.
Oh, thank you for having me.
So Lisa, you're here at Cantech to talk about your iUGO Care platform. What is that all about? Please tell us.
So iUGO Care is a platform that's used for remote patient monitoring and telemedicine, and our target patient base is the 37 million Medicare and Medicaid patients who have 2 or more chronic diseases like diabetes, hypertension, COPD, congestive heart failure, who represent 80% of all healthcare spending in the developed nations. And so that, for us in the US, represents $180 billion in potential annual revenue. So it's a very large market, but that has a lot of unmet needs right now. So we're really able to go after those patients in a way that no other company has to reach them where they are.
Okay. So how does this platform work in practice, and what exactly were those challenges in the healthcare market today that prompted your company to come up with this platform?
Yeah. So as I said, we spend the vast majority of our healthcare dollars in all of the developed nations on chronic disease patients, and the reason for that is that they end up hospitalized very frequently with complications from their chronic disease. Now, those complications can be avoided if those patients take good care of themselves in the home. Most of these patients are in the community. They don't have a lot of clinical resources. They might see the family doctor every year, but there's no kind of day-to-day coaching and patient education and reminders. And so what we do in the home, we use the Amazon Echo with the Alexa platform and a suite of sensors, as well as Bluetooth-enabled medical monitoring devices like blood pressure cuffs or glucose meters. And we remind the patient. So when they wake up in the morning, the sensors will detect movement and will say in any one of 133 languages, "Oh, Mrs. Jones, I see you're awake. It's time to take your morning medications." She can say, "I don't remember where they are," and it will automatically say, "Oh, it's in the kitchen next to the stove and a medication dispenser." When the patient takes their medications, we send that information through the cloud immediately to their clinical care team. We also provide alerts. So if the patient forgets to take their meds, their family members will receive an alert through our app. It's HIPAA compliant and secure, saying, "Grandma's not taking her meds, someone needs to give her a call." And so over the course of the day, we'll remind the patient to collect their vital signs. If there's any kind of an issue, very high blood pressure, for example, or low blood oxygen saturation, or if our sensors detect a fall, or if the patient says, "I'm having chest pains," we will either alert the clinicians, or if it's really an urgent issue, we will actually summon emergency services, much like a life alert kind of system. But it's all built into this holistic platform that coaches and educates the patient and allows them to really take control of their chronic diseases so that they don't end up in the hospital. But it's also got that safety net if there is an emergency.
Who are your customers and how are you reaching out to them?
So we sell to the frontline care providers in the US, so that's home care agencies, assisted living facilities, and family practices, so big groups of family doctors. And we reached out to them initially through our existing contacts in the healthcare space, but in healthcare, customers buy by reference. So at this point, our pipeline is full of customers who've actually come to us through the references they've received from these other home care agencies and family practices. So we have quite a backlog of customers who want their patients to be onboarded, which is a great problem to have. And I think you'll see a significant increase in the number of patients we have on the platform this year. Yeah.
So you launched in 2016, and like you said, you have a significant order of clients in your pipeline. Any heartwarming stories that have come forward ever since you launched this platform and it has seen adoption in the market?
Well, I think in terms of the patients, what we're seeing is that it's taking a huge burden off the informal caregivers, so the family members, but it's also making patients, we heard a lot from patients when we started with the company saying that after they're discharged home from hospital, they feel like they fell off a cliff or into a black hole. So in the hospital, in the ICU, someone's checking your blood pressure every hour, but then you go home and you check in with the family doctor every few months. Maybe you have a visiting nurse or nurse's aide once or twice a week for 20 minutes, but the rest of the time they're coping with these complicated clinical conditions on their own at home. And so our system has made them feel like the healthcare system more broadly still is engaged with them. Somebody still cares. There's a safety net if there's an emergency, so they're still receiving care. And in the chronic disease population, one of the biggest issues you have with compliance, so less than 50% of them take their medications as prescribed, which is what drives a lot of these complications and hospital admissions. And part of that comes from depression and isolation, so feeling that they've been abandoned by the system. So if we're able to make them feel that they're still part of the healthcare ecosystem and someone's still watching encouraging them and providing coaching and reminders, then they tend to take better care of themselves and be more compliant. And that is what really drives the positive health outcomes. So.
Okay, wonderful. Lisa, we wish you all the best with your iUGO platform, and thank you for joining us.
Thank you very much for having me.